Hello. This presentation is on evaluating the inclusion of disability and ageing in COVID-19 hygiene behaviour change programmes. So people with disabilities and older adults face a high risk of dying from COVID-19. Hand washing with soap and sanitising surfaces were recommended to disrupt COVID-19 transmission, yet in many low and middle income countries, these populations face barriers accessing water, sanitation and hygiene, or WASH, and public health campaigns. These relate to the impairment experience. So for example, a person with an intellectual or cognitive impairment, including dementia, may not remember when or how or why to wash hands. Assistive products such as crutches or wheelchairs, walking canes can pose a risk of contamination, since immediately after hand washing with soap, people might need to touch the product, which might not be clean. Some people will be reliant on caregivers to help them to practice regular hand washing. And in some cases, caregivers might not prioritise this. People with disabilities and older adults may be less able to independently collect, carry and pour water, and they may be less able to use hand washing facilities. Hygiene promotion materials may be difficult to read and understand. So in response to COVID-19, FCDO and Unilever launched £100 million Hygiene Behaviour Change Coalition, or HBCC, to mount a rapid response to contain and limit the spread of COVID-19 in low and middle income countries. And they funded 21 organisations to deliver 74 projects across 37 low and middle income countries to encourage the adoption of recommended hygiene behaviours. And project activities included the distribution of hygiene products such as hand soap and sanitisers, installing hand washing facilities at public locations, running media campaigns that promoted hand washing with soap and surface cleaning. So my study aimed to evaluate the inclusion of disability and ageing in HBCC interventions. It had two objectives. Firstly, to explore how people with disabilities and older adults were included in HBCC funded projects. And secondly, to support HBCC grantees to make projects more inclusive for people with disabilities and older adults. The evaluation was facilitated by PENDA, which is Programme for Evidence to Inform Disability Action, and PENDA is funded by FCDO. I did the evaluation with Lorraine Wapling, who's an independent consultant specialising in disability inclusive development. So through this study, we developed the COVID-19 Inclusive WASH checklist for including disability and ageing. The checklist was developed by reviewing and merging the ECRIFRAME framework and tool, normative criteria for specifying the right to water and sanitation, and 3 inclusive WASH checklists. The checklist can be used by WASH practitioners who want their COVID-19 WASH interventions to include people with disabilities and older adults. It can be used during the programme design stage, where suggested activities can be included to ensure core concepts of human rights are incorporated, and it can be used during intervention to identify ways to strengthen inclusion, but also when evaluating programmes. So the checklist contains 2 target groups, disability and ageing. Caregivers are included across both of those 2 populations. It covers 15 core concepts of human rights, including non-discrimination, participation and protection from harm. These sit on the left of the checklist. Next to those core concepts of human rights are guiding principles, and these are loosely worded like objectives. And then next to the objectives, to the right of the objectives, there's a list of suggested activities which can be carried out to achieve the guiding principles. References to core concepts were given a score of 0 to 4. So 0 is given to a concept when it's not mentioned. 1 to 4 progresses to actions and targets that are monitored and evaluated against a core concept. So this enables an assessment of the quality of commitment to the core concept of human rights. The higher the score, the stronger the commitment is. And we also used a traffic light colour system to denote progression. So this table sets out the scores with an example against the core concept of human rights, non-discrimination. Now, an example of a statement that would score 1, or orange, is we will target vulnerable populations such as people with disabilities and older adults. So that would get 1 because it only mentions non-discrimination. It doesn't explain exactly what the programme will do to work with those groups. A score of 4, cyan one at the bottom, would be given if actions and targets are mentioned and evaluated against the core concept. So an example of something written in a document could be, in collaboration with organisations of persons with disabilities and older persons associations, we identified 15,000 people with a disability, 7,000 of whom were aged over 60 years. So moving on to the desk review, what we did. We sourced a number of documents, and these were relevant materials that were submitted to Unilever, including project proposals, work plans, reports, media content. And together we reviewed 137 documents using the COVID-19 Inclusive WASH checklist. And we assigned a quality of commitment score 0 to 4 to each activity referenced. Once we had reviewed all the organisation's documents, we aggregated data across these organisations to show key findings. This graph shows the quality of commitment score to core concepts of human rights across all organisations for women and girls, disability and ageing. So if we look at women and girls first, that's the 3 bars on the left, you can see that 14 organisations have mentioned women and girls as a target. That's the orange bar. All of them have explained exactly what this means, that's the yellow bar, and all of them have included targets and actions against core concepts of human rights, that's the green bar. So this means that activities are included and budgeted for. Now we'll look at disability in the centre. So the orange bar shows that 17 organisations have mentioned disability, but only 6 have clearly explained what they mean by that, that's the yellow bar. And only 3 have identified targets and actions, that's the green bar. For ageing, 16 organisations mention older adults, but only 1 explains what they mean by that, and the same organisation has included targets and actions for that commitment. So in summary, people with disabilities and older adults were mentioned across most of the organisation programme documents, but clarity about what will be done and what activities will be assigned to these groups were remarkably lower than for women and girls. And out of the 3 population groups, commitment to ageing was the most limited. Caregivers of people with disabilities and older adults were not mentioned very often. Only 4 mentioned caregivers in relation to people with disabilities as a target group, and only 1 said that they would target caregivers of older adults. And this is of note because some people with disabilities and older adults may be reliant on caregivers for WASH. These caregivers might need different, or they do need different hygiene behaviour change messages and activities because they'll be supporting another person to understand COVID and the strategies to prevent it. We did find good practice. So for example, in Syria, an organisation designed activities that targeted caregivers who were also themselves often older people. And this project also trained community volunteers to adapt their hygiene promotion activities for people with different impairments. So in conclusion, the COVID-19 Inclusive WASH checklist provides practical guidance for the inclusion of people with disabilities and older adults in COVID-19 responses. And it can help organisations ensure their efforts to include people with disabilities and older adults are targeted and effective. HBCC grantees applied learning from this evaluation and strengthened their inclusion on disability and ageing in their projects going forward. Here are some references from the presentation. Thank you for listening.